morning, respected delegates, guests, faculty members, staff, research scholars and students assembled in this conference venue. On behalf of every stakeholder of Tripura University, I extend a very warm welcome to all of you to the IHEPA Winter School 2024-25 on Health Economics from February 17th to 21st, 2025. Organized by the Department of Economics, Tripura University, in collaboration with the Indian Health Economics and Policy Association, this winter school aims at sensitizing and grooming young postgraduate students, early career researchers and young faculty members to the indispensability of linking and applying economic theories to the discipline of healthcare, enabling healthcare seekers to choose and healthcare providers to offer healthcare-related goods and services to address a rapidly rising healthcare clientele across the globe. Despite the indispensability of health economics in the late 20th century, amidst our awareness of the slow and steady promotion of public health policies, both by the state and by private entrepreneurs, it perhaps took a catastrophic turn of events with the fatal COVID-19 pandemic to once again shake up the entire globe to sit up and take cognizance of the importance of health economics in the new millennium, with newly emerging ailments and lifestyle disorders and diseases. In view of these objectives, this winter school is set to open new vistas in this field. Among the luminaries present in this conference hall this morning, we extend a very warm welcome to the chief guest of this inaugural session, Senior Most Professor and Honorable Vice Chancellor in charge of Tripura University, Professor Badal, who has taken time out of his busy schedule to be here with us this morning. On behalf of all of us here, I extend a very warm welcome and heartfelt gratitude to our guest of honor, Professor Bhagirathi Panda, Honorary Director, ICSSR-NERC, Shillong. I also extend a very warm welcome to Professor Uday Shankar Mishra, President of the Indian Health Economics and Policy Association, IHEPA, a demographer and a statistician of inimitable merit, teaching at the Department of Biostatistics and Epidemiology in the International Institute for Population Sciences in Mumbai. Professor Mishra has several scholastic distinctions to his name and having contributed to numerous policy formations on aging, health, nutrition and population over his last 25 years of teaching and research. Besides, we have amidst us in this gathering several illustrious resource persons of great merit and distinction from all across India, from Mumbai to Delhi, from Bhagirathi and Kolkata to Bangalore. On behalf of the Tripura University fraternity, I extend a very warm welcome to all our resource persons and participants. May I now request the head of the Department of Economics, Tripura University, and chairman of the Organizing Committee, Professor Subharabaran, Professor Paramita, Shah, member Organizing Committee, and Professor Salim, Shah, coordinator of this winter school, to kindly escort our chief guest and guest of honor to the dais and also take their respective seats. Thank you. May I now request the head of the Department of Economics, Tripura University, and the chairman of the Organizing Committee, Professor Subharabaran, to felicitate our chief guest, Honorable Vice Chancellor in charge, Professor Badal. With a flower bouquet, Uday. Thank you, sir. Thank you, sir. I now request Professor Paramita Saha of the Department of Economics team and member Organizing Committee to felicitate Professor Bhagirathi Panda, Honorary Director, ICSSR-NERC, Shillong, who is our guest of honor. Thank you, madam. Thank you, sir. I now request Professor Salim Shah of the Department of Economics to felicitate Professor Uday Shankar Mishra, President IHEPA and Professor, International Institute for Population Sciences, Mumbai. Thank you, sir. I now request Dr. Shubjit Kumar Maji, Joint Coordinator, IHEPA, Winter School 2024-25 at Tripura University, and Associate Professor, Department of Economics, to felicitate first Professor Subharabaran, Chairman of the Organizing Committee. Thank you. I also now request Professor Dr. Maji to please felicitate Professor Paramita Saha, member Organizing Committee. Thank you, Dr. Maji. Now, I once again request Dr. Maji to felicitate Professor Salim Shah, Coordinator of IHEPA, Winter School 2024-25. Thank you. May I now request the dignitaries on the dais to initiate a green inaugural of the IHEPA Winter School 24-25 by the watering of a few plants we have in this auditorium this morning. Sir, please come. Please come. Let us initiate a green inaugural of this. The members of the Organizing Committee of IHEPA Winter School 2024-25 wish to spare a few moments of silence to offer heartfelt condolences on the untimely passing away of Dr. Nandakishore Ambari, an esteemed member of the Governing Council of Indian Health Economics and Policy Association on January 26, 2025. Before we observe a 2-minute silence, let me read out our condolence message. Heartfelt condolence on the passing of Dr. Nandakishore Ambari. With profound sorrow and deep sense of loss, we share the untimely passing of Dr. Ambari, an esteemed member of the Governing Council of the Indian Health Economics and Policy Association on January 26, 2025. Her sudden departure has left an irreplaceable void in our academic and professional community, and this tragic loss deeply grieves us. Dr. Ambari was a distinguished scholar and a guiding force in health economics and policy. Her unwavering dedication to research, policy development, and academic excellence made a lasting impact on the field. She played a crucial role in shaping health policy discussions in India and was deeply committed to advancing equitable and effective healthcare solutions. Through her pioneering research and advocacy, she contributed immensely to improving public health systems, influencing academic discourse and policy implementation. As a valued and respected member of IHEPA's governing council, Dr. Ambari brought exceptional wisdom, insight, and enthusiasm to every initiative she undertook. Her leadership, intellectual rigor, and commitment to fostering meaningful dialogue in health economics and policy will be profoundly missed. She was a brilliant academic and a mentor, colleague, and friend to many in the community. Her absence will be deeply felt by all who had the privilege of working alongside her. On behalf of the IHEPA Winter School 2024-25 Organizing Committee, we extend our deepest condolences to Dr. Ambari's family, friends, and colleagues during this incredibly difficult time. We hope they find the strength and solace to bear this irreparable loss. While she may no longer be with us, her invaluable contributions and enduring legacy will continue to inspire future generations. May her soul rest in eternal peace. I am on Winter School 2024-25 Organizing Committee. May we now maintain a 2-minute silence. Thank you. May I now request Professor Subharabaran, Head Department of Economics, Tripura University, and Chairman of the Organizing Committee, IHEPA Winter School 24-25, to deliver the welcome address.
A very good afternoon to all of you. Respected Honorable Vice Chancellor in charge, Professor Badal, Professor Uday, Shankar, Mishra, International Institute of Population Studies, Mumbai, and President of Indian Health Economic and Policy Association, Professor Bhagirathi, Panda, Honorary Director, ICSSR-NERC, Salih, Professor Madam Paramita, Saha, my colleague, Professor Salim, Shah, and all my esteemed colleagues from Tripura University and my dear participants and students. This is indeed a great pleasure to all of us that Tripura University is organizing IHEPA Winter School 2024-25.
Thank you, Professor Ross. I now request Professor Salim Shah, Department of Economics, Tripura University, and coordinator of IHEPA Winter School 2024, to introduce the focal theme of this Winter School.
Respected Professor Badal Datta, Senior Most Professor of Tripura University and ICSSR in charge, Tripura University. Respected Professor Bhagirathi Panda, Honorary Director, ICSSR-NERC. We have with us Professor Uday Shankar Mishra, the President of Indian Health Economics and Policy Association, and he is a very well-known academician all over the country. We have with us our Head of the Department, Professor Subharabaran, Professor Paramita, Shah, all my colleagues present here, and the staff of the university, the officers of the university, and all the participants, students, my volunteers. I warm welcome to all of you to this program. This winter school, as Professor Subharabaran has already told, that's supposed to be organized during the month of December. But due to many of the odds and constraints, we are holding it in February, and now winter is almost over. But still, this is a winter school. And the basic idea of this winter school, this is to train people, because you know what we do believe and we should believe, that academic interaction is the best weapon to excel ourselves. Because whenever we assemble together, all over India, the people, the participants who are coming from all the states of Northeast, except Mizoram, we in East Mizoram now. And from Jammu Kashmir to Kerala to Rajasthan to Odisha, West Bengal, UP, Delhi, and from many parts of Rajasthan and many parts of India. So this is a really very rich assembly here, and we would expect to learn many things from the resource persons, because the resource persons are very expert and the resource persons are very resourceful in real sense. But as well as whenever we people are interacting each other, the participants from various states, various parts of the country, then this is also an enriching experience for ourselves. And we miss Mayank Ambare, because one thing I must say, because already who Mayank you already is known to you, and Mayank was one of the key persons in organizing the workshop here at Tripura University. She has tried to motivate me now and then, every time, through chats, through phone calls and this and that, and tried to help me in different ways. And Mayank was one of the enlisted speakers, enlisted resource person for this session, you know. Now, regarding the winter school, then we have designed in such a way that, first of all, health economics, this is a very new subject, not new in all over the world, but new in India, and particularly for the states of Northeast. Many of the universities are here to introduce health economics in their syllabus. Here in Tripura University, we have introduced health economics as a special paper since 2011. So this is old in Tripura University, but many of the universities are not still or yet to introduce health economics. And what health economics? In the same term, health economics is application of particularly microeconomics and other tools of economics in the areas of explaining healthcare management. That is how we will go for our utilizing our scarce healthcare resources in the field of healthcare, in the practical field, and how we could have the maximum benefit out of the limited resources, because health resources are not very available. And like other scarce resources, health resources in terms of human resources, in terms of physical resources, in terms of supporting resources, those are not very available. That's why that must be taken care of, and some economic principle must be applied. Now, without research, without that discussion, without in-depth discussion, then it is not possible to develop the subject, as well as it is not possible to have the maximum social welfare. From that perspective, we need to know how to utilize the whatever the research resources are there. What are the research resources? Say National Family Health Survey. This database is there. IHBS, Indian Health that Development Survey is there. Then NSSO database is there. The WHO database is there. And many other databases are there which are readily available. But we need to penetrate into the database and just going till we know the level of the unit level. Then unit level data extraction, this is not a very easy task. And that's why some kind of training and rigorous orientation you need to handle this kind of unit level and how to extract the database and unit level database. As well as you need to orient yourself with how health economics project can be written, which are the funding agencies which will provide the funds, then which are the publication avenues. I think, and we thought, the Department of Economics, Tripura University, we thought in that way, where along with IHEPA, Indian Health Economics and Policy Association, and we sat together many times, and we have decided these are the basic areas of health economics, these are the basic instruments of research, these are the basic tools and techniques, those to be imparted among the participants during this coming 5 days. And in this study, we have with us Professor Shankar, who is a very famous academician and is very famous in health economics. We have with us Professor Subharabaran from RBI Chair, Professor University of Mumbai. We have with us Professor from Jadavpur University, then Dr. William Cho from Indian Institute of Growth. And then we have with us Professor Jinnatullah from Pubali, University. We will have with us Dr. from Sikkim University. So many are from Sikkim University, Subharabaran, and some others. Because this is the starting point, as I said. So that we will have a very good start. I should not take much of your time because the time is very limited. So thank you everybody.
Thank you, Professor Salim Shah. May I now invite Professor Bhagirathi Panda, Honorary Director, ICSSR-NERC, Shillong, our guest of honor.
Thank you so much. Very good morning to each one of you present here, sir. On behalf of my institution, ICSSR-NERC Knowledge Center, Shillong, and also on my personal behalf. This is a wonderful morning, and we have gathered here itself to discuss, to examine, and to deliberate and to learn, particularly on health and health economics. So I welcome each one of you present here itself. Professor Badal, Vice Chancellor in charge of this prestigious university, Prof. Uday, Shankar, Mishra, President of IHEPA, Professor Datta, HOD, Department of Economics of this very university, Professor Paramita, Saha, my friend, and also Professor Department of Economics here itself, and Professor Salim, Shah, Professor Department of Economics of this university, and also coordinator of this program. All of us are here together in this very hall, and for almost coming 4-5 days. It's really heartening that Tripura University, in collaboration with IHEPA, have taken up this very important workshop, and particularly on this issue of health. So what we have seen actually during the last 100 years, the concept, the approach, and the establishment space in development, in economics of development has expanded. Along with that expansion, I think one of the important components in this very journey of expanding the scope, the concept, and the approach to development relates to health. First of all, health and then health economics. I think all of you know Human Development Index, isn't it? You know, it was not easy to bring in this very concept and practice of human development into development practice all across the world, and in theory also. I think all the classical brothers, all economists and the practitioners were vehemently opposing this kind of arrangement, but subsequently, I think with UNDP, with Amartya Sen and Bible works and all that, ultimately we see Human Development Index being also used these days extensively in development theory and development practice. And we have 17 SDG goals that we all know. Out of that, goal number 3, which is all about health, you understand. So I can understand the importance that health is in, particularly in development theory and developmental practice, particularly when there is a revival, we experience there is a revival of developmentalism all across the world. And it's in that context actually health is important, and for that matter, let's come to health, isn't it? In the context of provisioning of health, in the context of, let's say for example, different kind of stakeholders who are there itself in the health space, like consumer, it's all about the consumer, we are studying the consumer behavior, the traditional behavior. Of course, in health economics, sometimes this is a kind of a challenge that sometimes individual himself or herself happens to be a consumer and also a producer of health services. Then you have the government, the private sector, I'm going to say, and many others. So it's all about understanding, I think, the health from the point of view of economics and also from the point of view of consumption, production, and also more importantly, I would say social welfare and social choice. We today, let me put this one or two data. We do face some very important challenges in the front of health, and that's why health economics is much more important today. 4.9% of the global population, very recently, they have been pushed to extreme poverty, basically because of this out-of-pocket expenditure on health. This is a very, I think, matter of extreme concern, I think, to each one of us, and particularly to policymakers all across the world, and particularly in developing countries. Then one woman every 2 minutes dies in our country, basically because of pregnancy or childbirth related issues. Similarly, 4.5 billion people all across the world, they have not been covered by any kind of essential health services. So I will be all in the coming 4-5 days will be giving a lot of more insights, particularly the health theory or health economics, the theoretical part of it, its conceptualization, and then the methodology, particularly the methodology diagrams on how to undertake the appropriate research, particularly when it comes to health economics or different dimensions, different issues relating to health economics. Those things, of course, will be taught and they need to be taught. And there is a significant innovation or development which has happened, particularly with respect to conceptualizing health, and the concept of public health and the concept of individual health, and also the methodological developments to undertake the appropriate and serious researching. Serious research having its own societal outcome. Those things, of course, will be taken care of during during the coming 4-5 days. With these words, I once again thank the organizers for giving me this opportunity to share some of my random thoughts with all of you. So thank you so much. God bless you and have a wonderful session for coming 4-5 days. Thank you so much.
Thank you, Professor Panda, for wonderfully charting out the kinship between sustainable economic development, lifestyle approaches, and health economics in the testing times that we are living in today. Despite myself not belonging to the discipline of economics, I've learned a new concept today: creative destruction. Thank you, sir. I now request the chief guest of this inaugural session, Senior Most Professor and Vice Chancellor in charge of Tripura University, Professor Datta, to deliver the address.
Good morning, everybody. And these health sector gradually increasing in India. Health economics. So thank you, everybody. Thank you, Prof. and Mishra. Thank you, Professor Bhagirathi, Panda, for coming here. Thank you, Professor Salim, Shah.
Thank you, Honorable Vice Chancellor in charge. May I now invite Professor Uday Shankar Mishra, President, Indian Health Economics and Policy Association and Professor, International Institute for Population Sciences, Mumbai, to deliver his presidential address.
Good morning, participants, Honorable Vice Chancellor in charge, Professor Datta, Professor Pubali, Panda, Professor Subharabaran, Das, Sir Salim, Saha, and Professor Paramita, and all other organizing committee members who have made this winter school possible at this location where actually we have been intending to conduct a capacity building of this nature for a long time. Let me pay my obeisance to my young friend Mayanka, whom we lost very recently. We have a team of young, old, experienced, less experienced individuals in this outfit called Indian Health Economics and Policy Association, which is a very young outfit, initiated about 10 years from now. I have been associated with this outfit, and what has been our intent? In fact, health economics as a field, health economics as a domain of research is very significant in a global stage. But let me tell you very frankly and candidly that what is health economics in India? If an economist works in the area of health, that becomes health economics. And we are in an era today with substantial amount of information. It is not merely to do with health, with all kinds of information exploration, I would say, which should intrigue many people as to what are we doing with this information. Are we doing justified use of this information to add to knowledge, to generate evidence, to test, to verify many things which are in action? And this organization IHEPA has was initially brought into existence with a group of activists, policymakers, academics, to have a forum to share issues and concerns in the field of health research. But we have slowly evolved into an agency where we want to fill the gap of generating young professionals who will perhaps pursue this field, given the evolving scenario of huge amount of information around you. If you may realize that some people indicated about large-scale surveys, you may also realize that our data ecosystem at large has become completely different during last 1 decade. And I may not be wrong in saying that the entire data ecosystem is a very underutilized one. It merely remains in government quarters, it merely remains in some forums like NITI Aayog or other agencies who produce information to give some evidence. Here we are trying to actually make you people provide some expertise. Necessarily a 1-week winter school will not make you learn everything. But we want first to develop your interest into this arena. We want to generate some preliminary expertise that you will remain engaged with this. And you will also be coming out with some kind of evidence which will be fruitful, which will be useful for programs and policy action in this country. In fact, being a teacher for last more than 30 years, I have realized one thing which I want to share with you with very much frankness. As to, in our country, learning has 2 domains. One is learning subject and learning expertise. Learning subject is very easy. Learning subject is everywhere. We have curriculum, we have subject, you get master degrees, you get MPhil, you get PhDs, you get subject expertise. But when it comes to expertise, expertise is something about skill. Something about skill building that we want to do. And that skill building, keeping at par with global stage. Keeping at par with situations where actually international arena people are engaging with. And one of the field is health economics, where even the global stage, if you look at, we have substantial amount of critical research in this area, and that is guiding a lot of policy interventions in European countries, in developed countries, and one of the reasons is that they were in the past very much rich in data sources and information at hand, which we were lacking, but the situation has changed. Situation is not the same what was 15-20 years back. We also have parallelly equal kind of information available in our country. In our country, in a huge country like ours, at very, very disaggregated level, we have information. But surprisingly, does those information get treatment? Those information do not get treatment. They get only published in reports. They never are optimally evaluated, interpreted, or those are not used with an intent of what is going wrong, is there a need for course correction? Never. And this is one of the prime intent that we want to generate all over the country, young academic, young scholars who will take interest, who will be at least shown the window of what are the kind of information availability, what are the kind of tricks, skills, techniques required to treat them. If these informations are treated optimally, treated intelligently, then they may reveal certain things which are of great utility. Therefore, in many places we do this winter school program for research scholars, postgraduate students, early career professionals, because nowadays access to information is not at all an issue. Because all of you are getting more information on your mobile than I used to get 20 years back by going to library. The only problem is that overflow of information sometimes makes you complacent also. Overflow of information sometimes makes you feel that everything is redundant. There's nothing to do. So we want to organize young minds into make interpretation of this information, make critical reading of this information, be inspective of it, that what does this information, what is its scope for me, what can I say about it? Because nowadays, remember, even a journalist cannot write a piece without quoting numbers. Nobody will read it. So I don't want all the young people to be journalists. Interpretation of information is not our job. Our job is to go behind it. Our job is to have those required skills to read this information in a manner that others can't. And there remains the key role of IHEPA, to skill people, to equip people with the state-of-the-art methods, the state-of-the-art advances which are in this area, whatever possible. So that it is up to you, we will open the window, if you don't go, you will fall back. But if you go further, we are always there to hold your hand. I never claim myself that, why I am able to say this way to you, because I personally am not an economist. I am a trained demographer statistician. I studied economics in intermediate. That's all. But I spent 30 years of my life among development economists. And I was finding myself something that what I will be identified as in the midst of economists. And then I realized that actually I have a much better role among economists than what I would have done as a demographer. Professor Shah has given me 2 sessions to engage you people with. And perhaps I will be able to make most of it. That I do what I say, I don't do teaching, I do conversing. There's a difference between the two. Teaching is what is written in the book to make you learn. Conversion is what I want you to do, you will do. If I cannot convert you, there is no benefit of teaching. After so many years of teaching in classrooms, I have realized one thing. If I don't leave a mark in terms of converting few individuals who are convinced about what I want to propagate, then I am a failure. And often it has been my success and pleasure to see all around the country, not today that I am here, wherever I have gone, about 5 years, 6 years down the road, I find a young individual actually pursuing the same thing. And of late, in this trip to Tripura also, I found a lady who was an IHEPA participant some years back, is currently working and drafting a book on health economics. It was such a pleasure to meet her that I personally felt that we are successful. Successful is not that the whole world you can change, but you must change a few which matters. And this initiative of doing training programs and capacity building, we have also launched a very fresh new journal, a very ambitious initiative called Health Empirics, where I encourage most of the people who work in the field of health or health data should attempt to write 3,000 to 4,000 words and submit. If you go to IHEPA site, we have launched this journal. We are creating a forum for you. How much successful it will be, it will not depend only on us, it will also depend on your contributions, your seriousness. Giving a forum is our job, but to make it alive and continue is yours. And finally, I must tell that we are running out of time. We started late. I do not want to give a kind of a sermon lecture, but I have a session with you before lunch. I think it is practically important for all around, and particularly with Professor Salim Shah's role in the governing council, taking up this responsibility, that we want to do something in the Northeast. We want to do it all over the country. In fact, we want to expand our membership and participation in this outfit all over the country, from many places, wherever there is work related to health going on. So when I see young people from all over the country participating in such a endeavor of ours, I feel more than pleased. I feel more than pleased, and I always get even threatened by the fact that do we serve them according to their expectation or not. With this challenge in mind, I would say that we will, with the scheduled set of resource persons that we have selected for this program, will deliver something to generate some curiosity in you, to maintain contribution in this field, and make health economics an arena of research, which will be fruitful, which will be rewarding, and that will be making a career for you with a distinction. Thank you very much, and let us feel that this becomes a successful endeavor to generate few young health economists. Thank you.
Thank you, Professor Uday Shankar Mishra, for sensitizing us on the practical side of expertise building in the discipline of health economics, with special emphasis on data building and data mobilization, culminating in policy formation. May I now invite Professor Paramita Shah, Professor, Department of Economics, Tripura University, and member Organizing Committee of IHEPA 2425, to propose the vote of thanks.
Thank you, Badal. Honorable President of this session, Professor Uday Shankar Mishra, our guest of honor, Professor Bhagirathi Panda, our head of the department, Professor Subharabaran, and the organizing secretary of this workshop, Professor Salim, Shah, my colleagues and friends from the university fraternity present here, and the participants and my student volunteers. A very good morning to you. This is a privilege to propose the formal vote of thanks. But before that, I do that formally. I must thank the organizing committee for allowing me this privilege, and particularly the organizing secretary. And regarding Professor Salim, I was telling that in our place, it's health economics is a new subject, but for your information, our Department of Economics has been offering health economics as a special paper since 2011. I think organization of this workshop will give a new fillip of our engagement with health economics in the economics department here. Now coming to the formal vote of thanks, I, on behalf of the organizing secretary and on my own behalf, say thanks to our Vice Chancellor in charge, Professor Badal Datta. I also thank President of this session, Professor Uday Shankar Mishra from IHEPA, Professor Bhagirathi Panda, Honorary Director, NERC, ICSSR, all the resource persons from outside the state and from inside, Professor Subrata Mukherjee, Professor Monalisha Chakraborty, Professor Jordi Borua, Professor Sushil Kumar Haldar, and Professor Pradut Guho, William Joe, everyone I thank. I also thank, but mostly I thank the participants who have traveled from far and away places, from different parts of this country, and most of all to the financiers of this workshop, the NEC, ICSSR-NERC, IHEPA, and our very own university, Tripura University. And most of all, for conducting this inaugural session in a very nice manner, our very own Datta. Thank you all. The Master of Ceremony with a small token of love from our department.